Good evening. My name is Rashid Baz. I'm from Moffitt Cancer Center, and we're at the American Society of Hematology annual meeting. And it's my pleasure to present this abstract of a clinical trial that is an investigator-initiated trial at Moffitt Cancer Center. The rationale for this trial is that the average age of patients with myeloma at diagnosis is 7 years of age. And this patient subset represents a group that is more vulnerable to side effects of treatment. So what we sought to do for this trial for newly diagnosed patients who are older is to start with weekly Daratumumab and dexamethasone for 2 cycles, and patients who achieve a partial response and better can continue on that therapy. On the other hand, patients who achieve less than a partial response could have bortezomib or lenalidomide added. The choice of which therapy to add is going to be guided based on a personalized medicine approach using a method called the ex vivo mathematical myeloma advisor. What we do is we take bone marrow aspirate from patients, isolate the myeloma cells, and subject them to different medicines ex vivo. And based on the response we observe ex vivo, we can predict the in vivo response. And that's the goal of this trial, is to try to not just do a sequential response adapted treatment, but also to do that in a personalized medicine way. So we've enrolled up until this point 25 patients. The average age is 79 years of age. And a lot of the patients are considered to be frail. About 50% of the patients are considered to be frail by the geriatric assessment that we have performed. Overall, I think the most important, impressive part of this trial has been the relatively low number of side effects we have observed that is possibly related to treatment. So the grade 3 and 4 adverse events are observed in no more than 4% of patients. Include things like hyperglycemia, agitation, confusion, hypertension, and neutropenia, anemia, and diarrhea. But these occurred in up to 4% of patients, which is a very, very low number. Other side effects were grade 1 and 2 side effects that were in higher proportion, included hyperglycemia, diarrhea, neutropenia, and these are not uncommon side effects of lenalidomide and dexamethasone. In terms of response, after daratumumab and dexamethasone, about a third of the patients achieved a partial response and continued on that therapy. The others had bortezomib or lenalidomide added. The overall response of the whole response adapted approach was 95%, which is quite good and quite in line with other induction regimen for newly diagnosed myeloma. And at 1 year, our progression-free survival is 90%. So we're continuing to enroll on this study. We're hoping to finish enrollment in the next few months. And we're going to continue to follow this patient, and subsequent analysis is going to look at the prediction of the ex vivo mathematical advisor that we've kind of developed at Moffitt as a way to personalize treatment for patients with multiple myeloma. Thank you for your attention.